Good morning, Shaimaa. Thank you so much for agreeing to this interview about your experience in the Global Brain Health Initiative program. The Global Brain Health Initiative is an international program, and so far there are graduate fellows from 60 countries worldwide, from all different disciplines, from medicine, the arts, economics, policy, journalism, and other fields. And the goal of this program is to improve brain health and to reduce the threat or the impact of dementia in local communities and also on a global scale. So with that, could you please describe why you applied for the program and what were you hoping to get out of it?
I applied for this program because actually I appreciate the importance of working together and the value of multidisciplinary teams in solving problems in neurological disorders. I have a major interest in cognitive impairment as well as movement disorders, and actually my work is in the intersection between movement disorders and cognition. So I found this program appealing as it matches my interests. When you have a healthy brain, you have a better part of life because you can do everything in your life.
Can you describe about the courses and content that you covered?
The whole program is based on the interaction. It's not dictatorial things. It's not we are just listening. No, it's mainly about us. We are the people who interact and give ideas, asking questions. We have a lot of discussion going on there. And the session itself, it was about the different brain diseases, starting from the anatomy and ending by the late life issues and how to prepare the patient for the end of life, living with these diseases. We have many sessions about ethical issues, sessions about health economy, and how we make good use of resources. How can we allocate and relocate resources in order to raise awareness and establish services for healthy brain and to manage dementia and different neurological disorders. We also have sessions about arts and its importance in brain health. And this was the part that I was really interested in, actually. And our all talks was about building a bridge between arts and science and find this point where both meet together and how we can make use of arts to simplify science and to convey messages about brain health, raising awareness, changing narratives, helping people to know more about their diseases and to live better with the diseases. And actually, this was the most interesting part.
You made a comment about how the message of art spreads much more quickly than the message of science, which was something that had struck you.
Yes, art is a global thing, and we all appreciate art, and we all are in contact with different kinds of arts. But not all people are interested in science. Not all people are appreciating science, and arts actually reach people easier, and people can receive this artistic message easier. And actually, arts builds civilizations. Arts can make a change. So if the science and arts collaborated, so we can make a great impact. It can just transfer messages for people. So it will help in raising awareness. As I said, it can help to change the view of people about different diseases. It can make them actually encouraged to show themselves if they are affected. They can help them to live better with the disease if they know better about the condition. And it can also help in the prevention.
And what were the skills that you've found that you took away from the program? And how have you been able to apply those to your career and to your day-to-day work?
It opens my eyes on the different aspects of the disease. You know, as a neurologist, we work with the patients, their family. We are so much interested in diagnosis and management, but giving less time for the human experience. And actually, this program is mainly focused on the human part of the disease. How can you empower the patients and family? How can you make them live better quality of life? So the clinical lived experience has a very high weight in the program. And the new concept to me was the patient public involvement and how it is important to involve people in your work as a clinician, as a researcher working in brain diseases, and the value of having this close contact with people on a human level, not only as a doctor and a patient, giving instruction and following up the course of the disease. No, you are trying to be part of this family or, group of people you are working with, and you give your instruction with passion, with hope. You are just taking care of every word that you are saying to your patients and their family. So actually, I think I become more empathetic, more human when I talk to my patients, and I put myself in their shoes most of the time and trying to convey my message, which is a lot of medical instructions, do this, don't do it, in an empathetic, hopeful way. And actually, hope was like the motto of our cohort. Hope. How can we find hope on all these destructive disorders, these neurodegenerative diseases? Are there any hope for people living with these disorders? Yes. And hope is part of the disease. How can we just emphasize the impact of hope in managing the neurological disorders? It's not only involving one person in one country. No, it actually involves the whole globe, and all people are impacted with this. And if someone is affected by the disease, we need to help them in different ways. And if I need to provide the best care for my people, I have to know how to do this by the help of others. And these others are colleagues from different backgrounds, are people having the same experience, and I have contact with them, and I know how to manage my patients according to the previous experience, how to connect these people together, and doing things like support group and communication for these people and their families to live better with the disease. So again, it's the human aspect of the disease. How can people get the most of their knowledge from each other and from dealing with and interacting with other people on a global level?
Yeah, I think that's a very important point, because we are fairly siloed as neurologists in terms of always thinking about things from a scientific perspective and working with scientific colleagues or other paramedical colleagues. We don't really interact with economists in our day-to-day jobs, or with, filmmakers or journalists in our day-to-day job. And it's a very important point, I think, in terms of taking a step back and looking at the disease from through different lenses and people's different experiences, and how maybe we could use some of those worldviews.
We have the Creative Brain Week is part of this fellowship, and the idea of the program is translating science into art. And the session that I attended, it was about the ear, the inner ear, and its role in balance, and talking about the ear, the vestibular system, and the movement of the hair cells, and how the electrical waves are finding their way into the brain, and how they are decoded there and how it controls hearing and balance. It was the second time to repeat this session for some people who attended before. And this is mainly directed to the public and to elderly people. And some people attending were having some early dementias. And it's great to see the response of these people to the lecture or the topic, and people are attentive. They have good memory for what they learned before. When they asking questions, my colleague asking questions, they got answers from these people who attended before. So actually, it was a very good way to educate people and to keep this sophisticated knowledge about the vestibular system, the ear, the hearing, for long in their minds, because it wasn't this regular way of teaching or educating, but it's an artistic way of learning and giving information. Another story was about my friend who works in policy, and she is interested in traumatic brain injury and providing the pathways for people having traumatic brain injury. So what is after the injury? What is after managing the acute condition of the patient? What are the pathways for rehabilitation? How can we help these people to live a better part of life? So how to talk to policymakers to change the rules for these people. And she is doing a wonderful work in talking to policymakers and to improve the part of life of these people. One of my colleagues, who is a well-known Irish singer and composer, how he used his talent and how he used being a popular figure to raise awareness about dementia. He wrote songs, and he is now writing a book with different stories to explain the brain in health and disease and to raise awareness about dementia in an artistic way. One thing also I like is the dementia choirs in Ireland. They have many dementia choirs where people are, singing together. And I was lucky to attend the launch of Dementia Trial Ireland, and to see one of these choirs live when they are doing their performance. You can spot who is the diseased, who is having the condition, and who is a caregiver, because when the old songs are there, they can just sing the song from their memory. When it is a new song, they use the lyrics and read from the transcripts. It was amazing. Another story is about our movie director who is interested in directing movies about dementia, to raise awareness about dementia. So a lot of stories, as you can see.
Yeah, I think they're very good points to illustrate, and maybe they're also take-home points for others, and particularly in terms of, as you talked about, different ways of educating patients that gives them an imagery to stick in their mind rather than reading paper or just trying to break it down into simple scientific terms. Maybe there's better ways to educate patients that we could all learn from. Are there any additional take-home points that you'd like to share with our listeners?
The experience was amazing because the actual learning happens in the office. When you have this interaction with different people doing different things. Yes, we have the interaction with the neuroscientists as part of the environment, but also we have this close connection to the creative people, the artists. And when we are talking to each other during lunchtime, during breaks, when we have this kind of short chat about what I'm doing, what you are doing, and we learn from each other, and we find the points where we can make collaboration. The value of working globally is more and more emphasized during this program, and having connection to people working in the field and connection and access to the patients during the BBI is very important. involving the patients and their families in the process of diagnosing, management, research making for brain disorders is things that I really appreciated.
Yeah, and I mean, it sounds like it's something that maybe many movement disorders, either trainees or even established clinicians maybe, or scientists may be interested in applying for these programs. And you can look online at the Trinity College website for the Atlantic Fellow Program in Global Brain Health, which shows you how to apply, and similarly at the UCSF website. But it sounds like a very worthy year spent in terms of gaining skills and changing your perspective on managing brain disorders and movement disorders.